Picture this. You're coasting along, feeling pretty good about your health insurance, only to hit a wall when a claim gets denied or delayed, leaving you scrambling to cover costs that could mean the difference between health and hardship. That's the stark reality for a significant slice of Americans, as revealed by a fresh poll that dives deep into our complex relationship with health coverage. But here's the twist. While most folks seem content overall, a hidden wave of frustration is bubbling beneath the surface, especially as big changes loom on the horizon. Want to know why this matters for you and your family? Let's unpack it all step by step, in a way that's easy to follow. A whopping majority of U.S. adults, according to the latest NBC News Decision Desk poll, conducted by SurveyMonkey, express contentment with their health insurance plans. In fact, 82% of respondents reported being satisfied, with a solid third of them going so far as to say they're very satisfied. This positive vibe is even stronger among seniors. Think 9 out of 10 Americans aged 65 and up who feel good about their coverage, and nearly half of them absolutely thrilled with it. For perspective, this includes many relying on government-backed options like Medicare or Medicaid, where about 9 in 10 users voice satisfaction. In comparison, those with private insurance, often through an employer, clocked in at 77% satisfied. It's a reminder that while no system is perfect, many find comfort in what they have. Yet, dig a little deeper, and you'll uncover a layer of discontent that's hard to ignore. Almost a quarter of those polled shared experiences of being denied coverage or encountering frustrating delays from their insurers over the past couple of years. For beginners navigating this world, imagine trying to get a needed medication approved only to be told no without clear reasons, or waiting weeks for a doctor's visit that's critical for your well-being. That's the kind of hassle we're talking about here. And this isn't just anecdotal. Surveys like this consistently highlight the tricky balance between access and affordability in America's healthcare landscape. As we head into 2026, with potential cuts to Medicaid and rising premiums under the Affordable Care Act, commonly known as Obamacare, these frustrations could intensify, affecting millions who depend on subsidies to keep costs manageable. Interestingly, dissatisfaction tends to spike among younger demographics. Just under a quarter of adults under 45 reported feeling unhappy with their insurance, a trend echoed by about the same percentage of college-educated individuals and political independents who expressed similar sentiments. And this is the part most people miss. It's not just about overall satisfaction. Real-world barriers to getting care are adding fuel to the national debate. NBC News has spotlighted these challenges extensively, from stories of denied claims to high-profile cases like the New York trial involving Luigi Mangione, accused in the killing of a health insurer CEO amid accusations of rampant denials. In the poll, roughly 24% of Americans admitted their insurer has stalled or rejected their requests for services, treatments, or meds in the last 2 years. Women, for instance, were notably more affected, with 27% reporting such issues compared to 21% of men, perhaps reflecting differences in how health needs manifest or how claims are processed. On the flip side, those with private coverage were slightly more prone to these setbacks, 26%, than public plan holders, 23%, though both groups face hurdles. Now let's turn to the elephant in the room: Obamacare. For those new to the topic, this landmark law, enacted in 2010, aimed to expand coverage and make insurance more accessible, but it's become a lightning rod for political battles. In the survey, opinions on its future were split. 46% preferred to maintain the Affordable Care Act as is, while 24% favored scrapping it entirely, and the rest, 31%, were undecided. Surprisingly, support for keeping it was nearly equal between private 47% and public 46% insurance users, a finding that challenges assumptions about who benefits most. Strong majorities among Democrats, 79%, Black Americans, 61%, women under 30, 59%, and all young adults under 30, 52%, lean toward preservation. Conversely, a majority of Republicans, 56%, and Make America Great Again supporters, 69%, pushed for repeal, along with 4 in 10 men over 65. But here's where it gets controversial. With health insurance costs skyrocketing as a hot-button issue ahead of the 2026 midterm elections, trust in political parties to tackle this mess is divided. A narrow majority, 57%, said they have faith in Democrats to handle healthcare affordability, versus 43% backing Republicans. Women particularly favored Democrats, 64% to 36%, while men were deadlocked at 50 to 50. This polarization raises big questions. Is Obamacare worth saving? Or does it need a complete overhaul? Are insurers prioritizing profits over patient care? And who should foot the bill for ensuring everyone has access without bankruptcy-level debt? These debates aren't just academic. They shape real policies that could upend your next doctor's visit or prescription refill. Ultimately, these poll insights, drawn from 20,252 adults surveyed online from November 20th to December 8th with a margin of error of plus or minus 1.9 percentage points, paint a nuanced picture of healthcare in America. Stephanie Perry, NBC News' exit polling manager, and Mark Trussler, Director of Data Science at the Penn Program on Opinion Research and Election Studies, contributed to this analysis. What do you think? Does your experience with insurance match these trends? Should we fight to keep Obamacare intact? Or is it time for a radical rethink? Share your thoughts in the comments below. We'd love to hear your take.